anyone who has a BMI of over 30 with weight-related medical conditions such as diabetes, high blood pressure, sleep apnea, they would qualify for weight loss surgery. Anyone above 35 BMI without any medical complaints would be a qualified person to avail weight loss surgery if they desire to do so. Hi, my name is Mr. Siva Gounder. I'm a bariatric surgeon based in Perth, Western Australia. I have over 20 years experience in surgery and have performed a few thousand weight loss operations and am able to provide good, safe, effective surgical solutions for patients who are struggling with their weight. A common question that I always get is, what is obesity? How does it impact my self? So when we talk about obesity, there's various definitions, but the most common definition that one uses to see if you're eligible for weight loss surgery is what's called as a body mass index, or BMI. Anyone who has a BMI of over 30 with weight-related medical conditions such as diabetes, high blood pressure, sleep apnea, they would qualify for weight loss surgery. Anyone above 35 BMI without any medical complaints would be a qualified person to avail weight loss surgery if they desire to do so. Obesity has a multifactorial cause. In order to treat it, surgery alone is not sufficient. You have to be able to have a multidisciplinary or multi-pronged approach to treat obesity. And we offer that in our practice with various specialist dietitians, exercise physiologists, and psychologists, as well as anesthetists. What are the options? If you ask what are the most common surgeries that's done, the more common operation nowadays is the laparoscopic sleeve gastrectomy surgery, followed by the gastric bypass operation. The laparoscopic sleeve gastrectomy in Australia forms over 70% of weight loss surgeries. It is done through little keyholes, and when a patient's asleep, where we go in and staple the stomach and reduce its size. Normal stomach is around 1,500 to 1,000 milliliters in size. This is then reduced to somewhere around 150 to 200 mils. By removing the outer section of the stomach, you will have decreased hunger, and because that part of the stomach produces some of the hunger hormones, and when one eats, you'll have a small entree-sized meal will fill you up. What you can eat after any of these operations is generally sufficient to keep you healthy. However, you will need to take some supplements, mainly being multivitamins. And good food choices are important, as the quantity is going to be much less. You need to really focus on eating nutritious food to keep yourself healthy. The other operation is a gastric bypass procedure, where the stomach is reduced in size, as well as small bowel is brought up to the new stomach and rerouting the passage of food. It is very effective for weight control. It gives about 10% more weight loss than the sleeve gastrectomy, and it's also quite effective for diabetes control. It does have different types of side effect profiles, and this is something that can be discussed with the surgeon when we make the decision. So between deciding which operation for which patient, it is important to tailor it to one's specific needs and goals. This is something that we do on our initial consult, and we come up with a plan. One of the common questions, is this going to affect my lifestyle? Am I going to have a safe surgery? The good thing is it's all done through keyholes. You will spend usually a night in the hospital, sometimes two. Most people are driving in a week and are able to go back to desk-based job within 2 weeks. It is very safe, less than 1% chance of any major complications around the time of the operation. And in the long term, you can expect a good long-term weight loss. However, nutritional issues such as low vitamin and iron levels can be sometimes a problem. Hence, taking vitamins coming follow-ups is important, and these can be addressed fairly well. Some operations have different types of side effects, like a gastric sleeve patients, 30% can get more reflux type symptoms, whereas with the gastric bypass, a condition called dumping syndrome can be experienced in about 30 to 40% of people, especially if they make wrong food choices. The surgery is at the current state most effective and long-term weight loss solution compared to just medication or lifestyle changes. Hence, the treatment is something that will give you good long-term outcomes as long as you find a team that's going to support you through before and after the operation, which is very important, the post-operative care, and good luck with your journey.